like to introduce you to the team who have drafted the report. Alex, what's the paper say?
So today, Jim, we're publishing Vive, devolution, devolved public services commissioning. We looked at the way that government designs policy in key areas such as healthcare, employment services and probation, and found that actually government would achieve better value for money if it devolved lots of these key services to the regions. And we concluded that over £100 billion worth of spend can be devolved to 38 regions across the country.
Gosh, that's actually significant. Maisie, governments have spoken a lot about devolution. Where are we with this?
So since 2000, 8 devolution deals have been agreed in England, and these have been agreed across the country, so from Cornwall to the northeast. Now originally these deals focused on improving economic productivity and tackling the north-south divide, but as the deals have progressed, government have realised that they offer real opportunity for delivering better value for money from public services. Especially because local areas can place funds in the public services that really tackle sort of local need and can improve outcomes for local people. Now the issue is devolution has really been devolution only in name at the moment and has been more like delegation because the centre has retained control of commissioning arrangements. But devolution of the adult skills budget, which is happening at the moment, show that progress can be made.
Oh, thank you. Alex, how far can we go with the devolution?
An awful long way. As Maisie said, this is about improving outcomes for people across the country. So in healthcare, to take a key example, a big area of spend for government, we see that 40% more people in the north of England die from preventable causes than they do in the southeast. That's simply not okay in terms of public services. So really what we're saying is a huge amount of this spend can be given to local areas so they can design interventions that meet the needs of local users, be they to stop smoking, which varies across the country, to improve activity, to reduce obesity, and we conclude that around 95% of the NHS's budget could be devolved to these regions to deliver this better integrated care. And we see that across the globe, examples from Spain to Scandinavia show that more devolved healthcare can improve value for money and services by tailoring them to these local needs. Now, this can also be achieved elsewhere. So if we look at employment services, there's a range in labour markets across the country, and so bespoke interventions need to be made in those services to get people back into the labour market. We say that this can go as far as Job Centre Plus, the control of that being devolved to local areas, and that is the same for skills and apprenticeships, as Maisie points to, and also in probation as well. So rehabilitating offenders across the country. Again, the range of offences varies. More drug offences happen in London than Yorkshire, as you might expect, but one-size-fits-all approaches don't help to stop reoffending in those areas.
Thanks, Alex. Ellie, what will local governments have to look like to deliver this?
Well, what we're actually proposing in this paper is quite a sort of radical change in the way that local government currently functions. As Alex mentioned earlier on, we would actually be looking at the devolution of commissioning powers in 38 regions. And I guess the sort of main idea behind this change is that basically currently services are not centred around people, as Alex has mentioned. It's sort of very difficult in that sense to have services that are integrated, that actually follow basically a sort of citizen pathway of how they interact with public services, and that's quite problematic. And one of the reasons behind this is because currently the actual geographical areas in which public services operate don't perfectly overlap with each other, which sort of creates fragmentation in services, sometimes actual gaps in service delivery, which is, ultimately for outcomes the sort of worst thing that you would want. And in this sort of service redesign, it would be a shifting of the current existing boundaries so that they would, let's say, sort of perfectly overlap, so that it could really. So basically there would be no systemic barrier in a way to public service reform, that basically all of these boundaries would overlap and a real sort of outcomes-based commissioning model could be delivered. That's what we're proposing.
Thank you very much. Well, Ellie, Maisie, Alex, thank you very much.